Assalamu alaikum dear doctors. In this video I am discussing about bronchiolitis. So bronchiolitis, this diagnosis is based on the HNP, upper respiratory tract infection prodrome. There is rhinorrhea, cough, tachypnea presence, wheezing present and increase the respiratory effort. The respiratory effort including grunting, nasal flaring and intercostal and subcostal retractions. And bronchiolitis occur less than 2 years of old. Remember, the age is very important and these are the features. Now, what are the risk factors of severe disease? That is less than 12 weeks old, history of prematurity, underlying cardiac disease and immunodeficiency. These are the risk factors of bronchiolitis. Test and monitoring we do, that is pulse oximeter and spot check, AAP, that is continuous the pulse oximeter, chest x-ray and close the patient, chest patient, that is chest x-ray we do. Now treatment including NC or HFNC, increase the WB. Now, oxygen saturation less than 90% when we give the treatment. IVF if not tolerating the paroral nasal suctioning. AAP recommends against albuterol. We say consider if fam history of asthma, atopy, hypertonic saline, no. If discharging from the ED, okay. If admitting, then racemic EP, steroids and antibiotics. Admit. When we admit the bronchiolitis, need supplemental oxygen, not tolerating paroral feeding, apnea, and underlying heart or lung disease. Strongly consider if less than 8 weeks, less than 4 kg, pulse rate 60 to 70 beats per minute or more than that, heart rate more than 180 beats per minute and history of prematurity. When we discharge bronchiolitis patient, we give the follow-up and evolemic tolerating per oral feeding, not hypoxic, awake, asleep and feeding, well appearing minimal work of breathing. This is all about bronchiolitis.